to stop your period by skipping the sugar pills in your birth control pack and just taking the active hormones every day. So if you have a horrible period, or maybe even if you just don't want to have your period anymore, you can't be bothered by having a monthly bleed, or maybe you're done having kids and so you don't see the point of having a period anymore, or maybe it's just an inconvenience. For whatever reason, you just feel like you don't want to have a period anymore. And you may have either been told, maybe by a doctor, or even you may have read it somewhere, that it's safe for you to skip the sugar pills or the placebo pills in your birth control pack and just continue taking the active pills every day. So that's what we're going to be talking about today. And before we even go ahead, I want to say that I've been in this boat before. I was put on hormonal birth control from a very young age because I had a horrible period. And especially when I was away from home, traveling, there was a time I used to work on the ships. And we used to wear white uniforms, and I didn't want to risk having a period while wearing a white uniform. I've had plenty of accidents in my life. I used to do this. I used to skip the sugar pills and just take the active pills. And once one pack is done, just go ahead and move on straight to the next pack. So if you don't know, and if you've never tried birth control pills before, the way they work is that the pills in the pack contain synthetic hormones, and you take one pill a day until you hit the week where you're supposed to be having a period. And during that week, the pills that you take during that week are actually placebo pills. So they don't actually contain any hormones. They're like inactive or sugar pills. And so what I used to do is I used to take all the active pills and then skip the placebo pills, just throw them away and move on to the next pack so that I just never had a bleed. And you may be wondering, you may be thinking that maybe this is an option for you, and you may be thinking, oh, is this safe to do? So let's dive into this a little bit more. So if you search, is it safe to not have a period? Is it safe to just take the active birth control pills every day? The general feedback you're going to get is that it is safe to do that it's not necessary for women to have periods. There's no physiological reason why we should have a bleed, and that generally speaking, doctors deem it to be safe. But the thing is, it actually depends which doctor you ask. So a conventionally trained doctor, GP, gynae, most doctors who trained the way I did would say that yes, it's actually safe to do that and there's no problem. But if you speak to an integrative doctor or a functional doctor, or a doctor who is kind of a little bit more aware of some of the potential impacts of birth control, then they may come with a different perspective. So I just like to share with you the bigger picture here. So most people are either on birth control, typically like 50% of people, they're either on birth control to prevent pregnancy, or they're on birth control for a period problem. Now, depending on which camp you fall into, you may be on birth control because you're done having kids, or you just don't want to have kids, or you may be on birth control because your period is just either very heavy or very painful, or maybe you have severe mood fluctuations and you just can't be bothered with having a really horrible period every cycle. Regardless of which camp you fall into, birth control does exactly the same thing for everyone. So hormonal birth control, whether it's the pills or the injections or the patches, typically speaking, what they do is they override your body's hormone system. So you make your own hormones during your menstrual cycle, and those hormones influence the lining of the uterus, and then if you don't get pregnant, then that lining sheds and you have a period. Now, when you're taking hormonal birth control, you're overriding that system. So you're shutting off your own body's normal fluctuations in your hormones. But then birth control also does a few other things. It tends to thin the lining of the uterus, which is where a fertilized egg will implant and attach so that the baby can grow a placenta and then start to grow and develop. So birth control, hormonal birth control, generally tends to thin that lining of the uterus, again, preventing you from getting pregnant. It also changes the mucus in the cervix to make it more hostile so that sperm cannot actually enter into the uterus to fertilize an egg. And most hormonal contraceptives will also stop you from ovulating. And that's really how they work, to prevent you from getting pregnant. Now, whether you're on birth control to prevent pregnancy, even if you're on birth control for a period problem, this is what birth control is basically going to be doing inside your body. So technically speaking, when you're on birth control, that bleed that you have during your sugar pill days, when you're taking the placebos, it's not actually a period, because by definition, before you actually have a period bleed, you would have ovulated. And because you're switching off ovulation when you're on hormonal birth control, technically that bleed is not happening because you didn't get pregnant. That bleed is only happening because you're taking the sugar pills that don't contain the hormones that are stopping you from bleeding. So that bleed when you're on birth control is not a period, it's actually called a withdrawal bleed. That's a very important thing to kind of get into your awareness, because some people will prefer to use birth control pills because they have this bleed every cycle, and they think that it's much better for them because for some reason they feel like it's healthier to have a period every month. And so when they see that bleed, when they're taking the placebo pills, they feel like, you know, their period is regular, they're bleeding normally, and, you know, they take it as a sign that somehow their cycle is regulated. But it's actually not the case, right? So it's a withdrawal bleed because there's no hormones in those placebo pills. Now, why is this a potential problem? Because if you're not ovulating while you're on birth control, then surely you can just continue from pack to pack to pack. And technically speaking, you can do that because when you're on hormonal birth control, you're not ovulating. But why is ovulation so important? And this is where the alternative opinion comes in. The reason why it's super important for women who have a menstrual cycle to be ovulating is because an ovulatory menstrual cycle is a sign of your overall health. It's actually a sign. If you have a normal, regular period, and if you're ovulating every single cycle, this is usually a sign that your hormones are in balance, and that it's an indicator of your overall health and well-being. In fact, it's considered the fifth vital sign. So your vital signs are things like your blood pressure, your pulse, how fast you're breathing, etc. These are all measures of your vitality, of your health. You know, when you go into an emergency room and, whatever you're complaining of something, maybe you have chest pain or something, they'll do your vital signs and they'll check to see how's your blood pressure, how's your pulse, how you're breathing, what's your oxygen level. These give us a quick snapshot idea of, are you in some kind of emergency situation where you need immediate support, or are you quite stable and comfortable, and can you wait a little bit before you're actually seen? It's called triage, right? And in fact, the American College of Obstetricians and Gynecologists has said that the menstrual cycle is the fifth vital sign for women. So this is important because the health of your menstrual cycle is not just about your period bleed. It's actually about your overall health. And the reason this is important is because we as women make our hormones during our menstrual cycle. So when you're shutting off ovulation, like what's happening when you're on hormonal birth control, you're actually shutting off those key hormones that are critical for your overall health and well-being. Now, you may be thinking, okay, but the hormones that you're shutting off are estrogen, progesterone, testosterone. These are really hormones that are responsible for your reproductive health and for your menstrual cycle. And that's mainly important for getting pregnant. And if you have no intention of getting pregnant, then there's no point in paying attention to your reproductive health, except for the fact that those hormones, estrogen, progesterone, testosterone, yes, while they are critically important for your reproductive health, they are also super important for other areas of your health, namely your brain health, for example. So I spoke about the other day on TikTok about the study that was recently done that actually looked at the brains of women at different phases in their menstrual cycle. So during your menstrual cycle, you have different phases: follicular phase, ovulation, luteal phase, menstruation. And they looked at the brains, they did MRI scans, and they looked at the brains of women at different points in the menstrual cycle. And they noticed that our brains physically change during our menstrual cycle. There's points in our cycle where our gray matter is thicker. There's points in our cycle where the amount of fluid that's kind of bathing the brain changes. And so we know that our hormones are having a dynamic influence on our brain health. And that's why you may experience that when you're at certain points in your cycle, if, for example, you have some kind of hormone imbalance, you may notice that at certain points in your cycle, you feel more depressed, you feel more anxious, you feel more feelings of hopelessness, and you may even have these thoughts of self-harm at certain points in your cycle. So your hormones are critical for your brain and your mental health. Your bone health is also influenced by these critical hormones, especially estrogen. Estrogen's like the builder hormone. And one of the things that estrogen does is it helps to support healthy bones. Now, if you're in your reproductive years and if you're young, this may seem insignificant to you because you may feel like, your bones are strong. There's nothing to be worried about. But this plays a super important role postmenopausally. So when you hit menopause and your body's production of estrogen drops, your reproductive hormones actually now start to play a role in postmenopause, because if your estrogen hasn't had a chance during your reproductive years to strengthen and support and nourish healthy bones, then the risk of osteoporosis when you hit menopause becomes an issue. Estrogen also plays an important role in your breast health. So again, maintaining the health of your breast is super important because of the risk of things like cancer of the breast, as well as the lining of the uterus. These hormones influence the lining of the uterus at different points in the cycle. They thicken up the lining at certain points, and then the lining sheds during the period. And that flux and that dynamic control that these hormones have on the lining of the uterus are super important for the health of the lining of the uterus. And again, the risk of things like endometrial cancer comes into play. So you can see that your hormones, yes, they're responsible for your period, but they also are responsible for critical areas of your overall health and well-being. And this is the reason why, when it comes to taking birth control for managing period problems, this is where my opinion comes in, which is that when you're shutting off ovulation because of a period problem, you're not only not addressing the period problem at its root, but you're also shutting off vital hormone production during a critical point in your lifespan as a woman that can have long-term health implications down the road. And this is why I'm not a fan of using hormonal birth control for period problems. I get it. When you have a painful period and you go on birth control, pain can improve. When you have a heavy period and you go on birth control, your bleeding can improve because it thins out the lining of the uterus. If you have PCOS symptoms, for example, and you're struggling with unwanted hair growth, then the birth control pill can improve some of that because the birth control doesn't contain testosterone and it shuts off testosterone production. So it can help with that. But the bigger picture is that hormonal birth control is actually not addressing the problem at its root. It's simply covering it up. And the problem comes in when you take the birth control away. Those problems oftentimes come back, but sometimes they're even worse than before you even started birth control. And so when it comes to wanting to switch off your period, my question is why? Why do you want your period to go away? Is it because you're done having kids and you don't see the point of having a period, but your period is not actually a problem? If that's the case, I would encourage you to embrace your menstrual cycle, because it's not only about bleeding, it's about the fact that you're producing hormones each cycle, which are critical for your overall health, not only today, but also in the long term. But if you're wanting to shut off your period because you're having a horrible time with your menstrual cycle and your period is driving you insane, then I would encourage you to get to the root cause of why your period is problematic in the first place and address the problem at its root, rather than the band-aid solution of just taking hormonal birth control to kind of cover up your symptoms. Now, I will admit that this is a little bit more of a complicated road, and sometimes it can feel very overwhelming because you don't know where to start. But I guarantee you that if you learn to get to the root cause of your hormonal imbalance issues and address the problem at its root, you're going to be putting yourself in a far better position, especially over the long term, with regards to getting to the root cause of the imbalance and addressing the problem at its root, and making sure that your menstrual cycle each and every month is healthy and regular. Because as women, this is a critical, vital sign of our overall well-being. Now, I will be putting out a more detailed video about how to actually do that, and the steps that it takes to kind of dive into your hormonal imbalance issue and address the problem at its root, because it does require a little bit more effort. But anything, I believe, anything in life that requires a little bit more elbow grease and a little bit more hard work is something worth having. And oftentimes, you know, unfortunately, when it comes to what Western medicine can offer, oftentimes when it comes to period problems and when it comes to addressing women's health issues, hormonal birth control is the prescription of choice. And that's not even going into some of the potential side effects of hormonal birth control, things like putting you at risk for blood clotting, increased incidence of non-cancerous tumors of the liver, nutritional deficiencies. So the birth control pills can tend to deplete vital nutrients, and even things like autoimmune disease and risk of thyroid disease as well. All of these are kind of part and parcel of the risks involved with using hormonal birth control for period problems. So I know it's a little bit of a mindset shift that kind of needs to happen, and I do think that, you know, doctors have a big role to play here as well, because oftentimes when we have period problems and we go crying to our doctors, oftentimes we're given birth control pills as the solution. But I just wanted to challenge us to kind of think more broadly about what's really going on with our menstrual cycles. Because if you think about it like this, the symptoms that you're experiencing, especially the symptoms around your hormone health, are your body trying to tell you and communicate with you that something is out of balance. And paying a little bit more attention to what those symptoms may mean and addressing the problem at its root is a far more sustainable and a far more holistic and beneficial approach when it comes to taking care of ourselves and nurturing ourselves, mind, body, soul. So this is the reason I'm not super keen on this idea of shutting off your period. To me, the menstrual cycle and your period represents your health. And I think that a lot of us would actually feel so much better if we just could understand what was going on with our bodies, and if we could unpack how to actually address the problem at its root. So if you have any questions about this, feel free to leave them for me in the comment section below. And if you're wanting to start your hormone health journey, then the first place to start is to get an idea about what your symptoms mean, get a basic understanding of the menstrual cycle, understanding each phase of the menstrual cycle, and then nurturing your body at each phase. So if you're looking for a guide or a plan or a way to do this, you can check out the link in the description box below. I've got the 28-day hormone balance reset guide there for you. And it really just is a quick and easy guide to get you started on your hormone health journey. So I hope that you found this helpful, and if you did, feel free to share it with somebody that you know who may find it helpful too, and I'll see you in the next video. Take care.